Hi, I'm Brianna. I'm one of the occupational therapists here with Newman Therapy Services. My role as an occupational therapist is mainly just to help patients be as independent as possible. Here in the hospital, we work with patients for a variety of reasons, and we work with them on things like general strengthening and conditioning, education on energy conservation and activity modification, safety, or adaptive equipment training so that they can be more independent with their activities of daily living like dressing, bathing, grooming, or toileting. So with that in mind, our main role with occupational therapy is just helping patients become as strong and independent as possible with the goal of returning home. A common thing you'll see occupational therapists in the hospital doing with patients would be training them on the use of adaptive equipment for dressing. So we use multiple tools for this. One of those is a dressing stick, and a common use for this would be to push shoes, socks off over feet, and maybe even pants. So getting off shoes, taking off socks, and then we will also train patients on how to use reachers, not only for just picking things up off of the floor, which does help prevent falls, but also for putting pants on. So we teach patients to grab the front waistband of the pair of pants, lower it down to their feet, pull it up, just like an extension of their arm. So once we are ready to put a sock back on, we would use a sock aid or a sock donner. So to use this, you take your sock and put it over the device with the heel on the bottom side. Then you take it by the ropes, throw it out in front of the foot, slide the foot in, and just pull on like that. That is how you use a sock aid or a sock donner. Once we're ready to put shoes back on, we have a long-handled shoe horn for that. So this works just like a regular shoe horn, just with long handle. So toes go in, the shoe horn comes behind the heel, and then you push the heel down in the shoe. So we have a lot of different tools. These four are probably the most common tools that you'll see in the hospital setting. We may also issue elastic shoelaces or long-handled bath sponges to patients, among other things. So this equipment really comes in handy for patients with back problems, breathing problems, patients that just can't reach their feet anymore, patients that may have had abdominal surgeries, hip surgeries, things like that. So this helps patients to gain a lot of independence with lower body dressing tasks and bathing tasks. So you will see a lot of this equipment in patient rooms. I think it's really important for you as a nurse to know the role of occupational therapy, because oftentimes you're going to be the first ones with the patients, spending any kind of time, taking them to the bathroom, seeing them put on their socks, to really know what their deficits in function are. So by knowing the role of occupational therapy, you'll be able to relay to the doctor whether or not they could really benefit from occupational therapy services.